Hello everyone, my name is Mara Isabel Arias, and the case I will be presenting today is high prevalence of recent cocaine use and the unreliability of patient self-report in an inner-city walk-in clinic. Key information. The purpose of this study was to compare self-reported drug use to results from urine screening. The participants of the study were males, predominantly African American, between 18 and 39 years old, who were admitted to emergency care during the weekdays at Grady Memorial Hospital. Participants were unaware that their urine was being tested for illicit drugs, since they were told that the study was about asymptomatic carriage of STDs. Information about the article. The title is High Prevalence of Recent Cocaine Use and the Unreliability of Patient Self-Report in an Inner-City Walk-in Clinic. Authors are Sally McNaghy and Ruth Parker. And the journal that published this article would be the Journal of American Medical Association. Methods used in the study. The inclusion criteria for the study was males between 18 and 39 years old that were sexually active within the last 6 months. Exclusion criteria was presenting urogenital complaints, history of kidney disease, antibiotic use in the last 3 weeks, and being too ill to delay medical care. Subjects were paid $10 for participation and gave informed consent for the STD study. Participants completed a questionnaire and provided a urine sample. Within this questionnaire, there were questions about their illicit drug use as well. Methods continued. Urine samples collected were tested for cocaine metabolites. Confidentiality of the patient samples was done by using a unique identifying number that was later removed from the consent forms, so there is no link between the patient and the sample. The results of the urine screening were then compared to the questionnaire answers using two-tailed Fisher's exact test. The results of this study are presented here in the first table. Of the 415 participants in the study, the cocaine metabolite was positive in 160 patients, or 39% of them. Age, race, and STD history were statistically associated with a positive urine assay. There was no statistical significance in education, insurance status, or chief complaint when admitted into the hospital. The results with statistical significance are the following. Men with a positive urine test were more likely to admit nonspecific illicit drug use within the prior year than cocaine use within the prior year. Of the 160 men that tested positive for cocaine, 21.9% and 28.1% admitted to illicit drug use within the last 48 hours and 72 hours prior, respectively. As shown from Table 2, comparison with subjects with positive cocaine metabolites who admitted or denied illicit drug use within the prior week, patients who tested positive and admitted to illicit drug use within a week were statistically more likely to admit to cocaine, marijuana, or heroin use than those who denied illicit drug use with a positive urine assay. Moving on to the conclusion of this case study, which is that there is a cocaine abuse problem for young men in inner-city walk-in clinics, and self-reporting of illicit drug use is not a reliable source. Accuracy of self-reporting can be increased by asking less specific questions. African American race and prior history of STD were statistically associated with an increase of having cocaine metabolites. Compared to the 1990 National Household Survey on Drug Abuse Self-Report rate at 12%, and the study self-report rate at 42.4% show that there is a large discrepancy that highlights cocaine abuse among poor inner-city young black men. Relevance and future direction. The relevance of the study is to provide accurate results on the use of cocaine in this population, and to demonstrate that self-reporting surveys are not reliable. There is a severe underestimate on the use of illicit drugs, and policymakers should be made aware when gathering information. Review of the literature. Cecilia Bach analyzed this study, focusing on a specific line in the article. Patients were not told that their urine would be analyzed for cocaine metabolites. However, patients were never told that their urine would not be tested for drugs. The informed consent of the patients did not include the aim of the study, therefore they are not able to weigh in the risk for themselves. Confidentiality was not explicitly assured to patients since they were unaware their urine would be tested for cocaine. This suggests a different study design would have been more appropriate, with either transparency and informed consent or substituting urine samples with another questionnaire to protect participants. Personal analysis. This case study was conducted to test how reliable self-reported drug use is when compared with a urine screening. The ethical concern is hiding the aims of the study and deceiving the participants by omitting crucial information, both of which are violations of the Nuremberg Code. Issues with the experimental design is targeting a vulnerable community and recruiting patients in a clinic. The statistical analysis is biased in its association with race as an increased risk because 91% of the participants are Black. This study creates mistrust in research and also promotes negative stigma. It can be compared to the result of the Tuskegee trial, which was mistrust between the African American community and research.